Hi, this is Dan VIlela, and this is my cystic fibrosis presentation. So, what is cystic fibrosis? Well, cystic fibrosis is a genetic progressive disorder that causes severe damage to the lungs, digestive system, and other organs in the body. So, it affects the cells that produce fluids like mucus, tears, saliva, and sweat. Now, normally these fluids are thin and slippery, which act as a lubricant. But in cystic fibrosis, there's a defective gene that actually causes these fluids to be thick, which instead of being a lubricant, clog up the different tubes, if you will, in our bodies. And this is most commonly seen in the lungs and pancreas. So in the lungs, mucus clogs the airways and traps germs like bacteria, which lead to chronic lung infections, inflammation, respiratory failure, and other complications. So normally, our lungs can flush out this mucus along with the pathogens, but in cystic fibrosis, they get trapped in this thick mucus layer, which again causes these chronic infections. Now, the pancreas creates enzymes, which are important chemicals that break down fats and proteins and carbohydrates and other nutrients, which then send them off to the rest of our body. But in people with cystic fibrosis, the small tubes that transport these enzymes out of the pancreas become blocked with mucus. And then the enzymes build up in the pancreas instead of reaching the digestive system. And this causes pancreatic insufficiency. And people with this disorder tend to be small in stature. They have something called failure to thrive, which basically means they don't gain weight appropriately because they're unable to absorb these nutrients which they need to grow. Now, the gene responsible for cystic fibrosis is the CFTR gene, or cystic fibrosis transmembrane conductance regulator. And this gene is responsible for producing tears, saliva, sweat, mucus, and other digestive fluids. Now, the gene is located at chromosome 7 at the 7q31.2 location. So what actually happens with this gene? So cystic fibrosis is caused by a mutation in this gene, and there can be different types of mutations, but the most common one is at delta F508, which is right here. So the deletion of these three nucleotides result in a loss of the amino acid phenylalanine. And as a result of this, the protein doesn't fold normally and it is more quickly degraded, which is what causes the mucus to become thick. Now, how is cystic fibrosis inherited? So this is a simple pedigree chart that shows how it is inherited from parent to child. Now, cystic fibrosis is an autosomal recessive disease, which means that the abnormal gene has to be inherited from both parents in order for the child to be affected with the disease. Now, they can also become a carrier, but not necessarily have the disease. So let me show you how this works. So imagine you have two parents. One parent let's just say she is normal for the purpose of this demonstration, which shows here that she is homozygous dominant, which means she doesn't have the disease or the trait for the disease. And let's say this parent over here, the dad, is a carrier for the disease. So if these two parents were to have a child in this circumstance, with the father being the carrier for the disease, then their child will have a 50% chance of being normal like mom, a 50% chance of being a carrier like dad, and a 0% chance of actually having the disease. Now, let's say both parents are carriers. If this is the case, then their child will have a 25% chance of being normal, not having the disease, or being a carrier, a 50% chance of being a carrier, and a 25% chance of actually having the disease. So now let's say one parent is normal, and one parent actually has the disease. So let's say dad has the disease. In this case, the child will have a 0% chance of being normal. So, which means she has a 100% chance of being a carrier, but also a 0% chance of actually having the disease. Now, let's say that one parent is a carrier and one parent actually has the disease. In this case, the child has a 0% chance of being normal, a 50% chance of being a carrier, and a 50% chance of actually having the disease. Now, unfortunately, if both parents have the disease, then their child has a 100% chance of also having the disease. So there's different ways to test for cystic fibrosis. A common way to do this is newborn screening. This is a very safe way to do it. So blood is taken from the baby's heel and tested for immunoreactive trypsinogen, or IRT, which is a chemical produced by the pancreas. They test the different levels to see if perhaps the patient has cystic fibrosis. This isn't necessarily diagnosable. If the patient comes back positive, so to speak, um, for this enzyme, then what they'll do is they'll just do another test. And then if that one is also positive, then they'll take it further and do genetic testing. Now, the gold standard testing is something called the chloride sweat test. So what happens is an electrode is placed on the child's skin, and small pulses um, are sent onto this electrode, through this electrode onto this patch that has medicine on it, which allows the skin to sweat. So then the sweat is collected on a filter paper or gauze, and this happens for about 30 minutes or so. And once they have enough sample collected, then they test for the chloride concentration. So patients with cystic fibrosis tend to have a higher chloride concentration, which actually makes their sweat taste very, very salty. Now, if a doctor wants to do a test, or a parent wants to do a test prenatally before the child's born, there is a couple ways. The more common way is something called amniocentesis, which is a procedure in which amniotic fluid is removed from the uterus for testing or treatment. There is some risk involved, but it is relatively safe. It's usually performed between 15 to 18 weeks of pregnancy. The amniotic fluid is then tested for the defective cystic fibrosis gene. Another way to do this is, it's a similar way. It's called chorionic villus sampling, or CVS, where a sample of chorionic villi is removed from the placenta for testing. The sample can be taken through the cervix, which is much less invasive, or transabdominally, kind of like the amniocentesis. CVS may be better if you and your doctor want to know the test results during the first 3 months of pregnancy. So if there is a concern, this can be done very early on, usually done between 11 and 14 weeks of pregnancy. So that is my presentation. I hope you enjoyed it. Here are my references, and thank you very much for listening.